ICD-10 Chapter 1 Practice Questions Medical Coding Study Guide 35 Need-to-Know Questions. Question 1. A patient is HIV positive with a history of pneumocystis jirovecii pneumonia but is currently asymptomatic. Which code is assigned? Z21, B20, R75, Z11.4. Once a patient has an HIV-related illness, they are always coded B20, even if currently asymptomatic. Question 2. A patient is documented as a nasal carrier of MRSA but has no active infection. What code is assigned? A41.9, Z22.322, B95.62, J15.212. Z22.322 is the code for a carrier of methicillin-resistant Staphylococcus aureus. Question 3. What is the correct ICD-10-CM code for typhoid fever? A02.0, A01.0, A01.1, A00.9. A01.0 is the specific code for typhoid fever in Chapter 1. Question 4. A patient presents with Plasmodium falciparum malaria. Which code is used? B50.9, B51.0, B50.0, B54. B50.0 is used for Plasmodium falciparum malaria with cerebral complications, B50.9 for unspecified. Question 5. Which code represents Zika virus disease? A92.8, A92.5, A92.9, B33.8. A92.5 is the specific code for Zika virus disease. Question 6. A patient is diagnosed with sepsis due to MRSA. How are the codes sequenced? A41.02, B95.62, A41.9, J15.212, A41.02, B95.62, A41.02. A41.02 represents sepsis due to methicillin-resistant Staphylococcus aureus. Additional codes for infection sites may follow. Question 7. A patient with HIV is diagnosed with pulmonary tuberculosis. Sequence the codes. B20, A15.0, A15.0, B20, Z21, A15.0, O98.7, B20. Per guidelines, B20 is sequenced first followed by the HIV-related condition, TB. Question 8. What code is used for a patient with a positive HIV test but no symptoms and no history of HIV-related illness? B20, R75, Z21, Z11.4. Z21, asymptomatic HIV infection status, is used for patients with no history of HIV-related conditions. Question 9. A patient presents with a cold sore herpes viral vesicular dermatitis. Which code? A60.0, B00.1, B00.9, A60.9. B00.1 is the code for herpes viral vesicular dermatitis, cold sores. Question 10. What is the code for Lyme disease? A69.20, A69.21, A69.22, A69.29. A69.20 is the code for Lyme disease, unspecified. Question 11. Which code is assigned for shingles, herpes zoster, without complications? B02.9, B02.8, B01.9, B00.9. B02.9 is herpes zoster without complications. Question 12. A patient has infectious mononucleosis. Which code is assigned? B27.90, B27.00, B27.10, B27.80. B27.90 is infectious mononucleosis, unspecified, without complication. Question 13. Which code is used for whooping cough due to Bordetella pertussis? A 37.00, A 37.90, A 37.10, J02.9. A 37.00 is whooping cough due to Bordetella pertussis without pneumonia. Question 14. Code for a patient with scabies. B86, B85.0, B87.0, B88.0. B86 is the specific code for scabies. Question 15. A patient is diagnosed with candidiasis of the mouth, thrush. Which code? B37.0, B37.3, B37.81, B37.9. B37.0 is candidal stomatitis or thrush. Question 16. What is the code for chickenpox, varicella, without complication? B01.9, B01.89, B02.9, B01.2. B01.9 is varicella without complication. Question 17. A patient is diagnosed with hand, foot, and mouth disease. Code: B08.4, B08.5, B08.8, B00.1. B08.4 is the specific code for enteroviral vesicular stomatitis with exanthem, hand, foot, and mouth disease. Question 18. Which code is assigned for viral warts? B07.9, B07.0, B07.8, B08.1. B07.9 is viral wart, unspecified. Question 19. A patient has asymptomatic neurosyphilis. Code: A 52.10, A 52.15, A 52.2, A 52.3. A 52.10 is symptomatic neurosyphilis, however A 52.2 is for progressive general paresis, A 52.10 is used for unspecified neurosyphilis. Question 20. What is the correct code for cholera due to Vibrio cholerae 01, by Ovar Elter? A 00.0, A 00.1, A 01.0, A 09. A 00.1 is cholera due to Vibrio cholerae 01, by Ovar Elter.